Schatz. She's a 32-year-old female, gravida 3, para 1 at 38 weeks gestation by last menstrual period. A 16-week ultrasound presents to the OB unit for evaluation before her scheduled repeat C-section. So we tried version yesterday with the intent of inducing labor, but we were not successful. So currently she's afebrile. Her blood pressure is 122/76. The monitor demonstrates a reactive fetal heart rate pattern. Baseline 140, no decels with moderate variability. So she has no contractions right now. Currently the fetus remains in frank breech position with the back on the maternal left. Her fundal height is 40 centimeters, and again, I can't feel any contractions. So upon vaginal exam, she's 2 centimeters dilated, 75% of face at -3 station. Her membranes are still intact, but she does have scant white discharge present. So we did an ultrasound this morning, we confirmed the fetal position, and we're just gonna get her ready for the C-section later. So she did have one previous C-section, but other than that, if you guys can just get her ready for the OR, that'd be great.
Sounds good.
Okay. Good luck today, Carol, okay? I'll see you tomorrow.
Okay.
Hi, Ms. Schatz. My name is Kaylin. I'm one of your nurses today. I'm just going to run through the pre-op checklist, and I see that you've signed your consent. Do you have any questions?
Not right now. I am so nervous. You know, my husband's in Iraq, and I wish he could be here for me. But I'm glad my sister could be here today.
Are you going to be in the OR?
Yes, I would love to be.
Okay. We'll get you dressed and ready to go, too. My name's Cassandra. I'm just going to do a quick physical assessment on you.
My name's Alexa. I'm just going to hang an IV bag and get you some pre-op meds, okay?
Ms. Schatz, can you verify your name, date of birth, and blood type, please?
Carol Schatz, June 2nd, 1987, and my blood type is O positive.
Okie dokie. So I'm just going to put a bracelet or wristband on your ankle and then another one on your wrist
Why
for
is
when you go
that?
down to the OR. Because when you're in the OR, there's going to be people at the head of the bed and at the foot of the bed, so you want to make sure that she's got identification on all of her limbs, and then when her baby is born, they can match the mom to the baby.
Okay. And what was the gravida para thing that you were talking about?
So that means that she's been pregnant 3 times and has given birth to 1 living child.
Okay.
Yeah, I had a miscarriage a couple years ago.
I'm sorry to hear that.
Ms. Schatz, do you have any allergies?
Yes, I do.
To what?
I'm allergic to minocycline.
What happens when you take it?
Oh, that was awful. I got the shakes, I had chills, I had a fever. I never want that drug again.
Okay. When was the last time you ate or drank anything?
I think about 7 o'clock this morning.
Okay. And last time you voided?
What's voided?
When was the last time you went to the bathroom?
I think about 7 o'clock this morning.
Okay.
106/64, 88.
Is that
Can you
okay?
take a couple
Yes,
deep breaths
that's
for me,
both
please?
very good.
Okay. And what's this drug that you're giving her?
So I'm giving her lactated ringers. It's going to help with her any dehydration during the surgery.
Okay.
Ms. Schatz, do you feel any pain when I push this this fluid through your IV site?
Not right now.
Okay, good.
Do you wear dentures, Ms. Schatz?
I'm a little young for that.
Okay. Hearing aids?
No hearing aids.
And you took all your jewelry off?
I left my jewelry at home because I had a C-section with my first baby.
Okay. Would you like to keep your glasses on until transport comes, or do you want me to take them off and give them to your sister now?
I think I want to keep them on. I'm pretty nearsighted.
Okay, that sounds good.
Lung sounds are clear and bilateral. Heart is normal and regular.
That's good. I'm just
Yes.
All good.
I'm
Okay.
going to put a few monitors on. The first one measures contractions, and the second one's going to measure the baby's heart rate.
I heard you guys talking about decels. Is that what this measures?
Yeah, so decels are when the baby's heart rate will dip during a contraction, and she's not having any of that.
Okay. Good.
Yeah, I haven't had any contractions this morning.
Ms. Schatz, I'm going to give you a medication called sodium citrate. It's going to help your stomach during the surgery. Can you give me your name and date of birth?
Carol Schatz, June 2nd, 1987.
There you go.
So how's the baby's heart rate?
It's in the 140s, so it's looking good. It's supposed to be between 120 and 160. So,
Oh, that's good. I'm so relieved.
ready?
Call transport?
Yeah.
Okay. I'm going to take your glasses off now, okay?
That's the
to sing. Yeah. Do you guys have any questions?